Alrighty, this is group one. My name's Jenna.
My name's Alyssa.
And my name is Miranda.
We chose to research the Kim and Carolyn Gardner Crisis Care Center for the Crisis Agency Research Project. Kind of an overview of what the agency does is it's open 24/7 and offers mental health care to anyone in need. No one is turned away regardless of their financial situation or the crisis type of crisis they're going through. You get to access to meet with a medical provider, a nurse, peer support if needed or wanted, and then also a social worker. And so they're located at the 955 West, 3300 South in South Salt Lake, and their phone number is 801-583-2500.
Okay, so for interview highlights, some crisis intervention approaches were short-term stabilization, which focuses on rapid assessment and stabilization to determine the next level of care. The no wrong door policy. The facility accepts walk-ins and drop-offs from first responders. Those in acute distress are not turned away because of administrative barriers. And also, diversion from legal and emergency systems. It works as an alternative to jails or the ER for those experiencing mental health and substance use crisis. Some specific techniques and methods are crisis management therapy, which is a brief, intensive therapeutic intervention to de-escalate, peer support specialists, individuals with lived experience who help patients navigate the system and give unique emotional support, and also medication-assisted treatment, which is used for those dealing with chemical dependency and withdrawal. So continuing with that, the training and support are boundary setting, learning how to maintain strict professional boundaries. So that means avoiding creating outside relationships with patients and using best practices. Staff is encouraged to follow established simple best practices instead of overcomplicating interventions. As well as emotional support, the agency does acknowledge the reality of patient loss, treating it as difficult but inherent risk of behavioral health care that requires resilience. Some challenges faced are systematic barriers. So financial strain can be an issue with patients that have to have time away from work, which can create new crises for those living paycheck to paycheck. The revolving door perception, which is successful cases leave and are never seen again. So the staff primarily sees patients who struggle to get better or have a hard time breaking the cycle. And finally, the autonomy versus safety, the constant ethical struggle regarding inpatient treatment, balancing the need to save a life with the reality that taking away their control can make their recovery harder.
All right, some professional connections and insights. The research done here connects with the core concepts we have learned by following best practices. Don't give advice to the client. Keeping professional boundaries laid out for the crisis workers. Do not develop an outside relationship with any client. Privacy laws are client-centered. There may be times when family do not agree or are confused about the privacy laws. For example, like maybe a family member wants their relative to be there and the person doesn't want to be there. Um, and and then maybe like they don't put them on a ROI and don't want to speak to their family because their family put them in there. Things like that. It can get confusing. It's good for the crisis worker to keep up on the latest trainings for continuing education. This experience has influenced our understanding of the field by showing the reality of what it means to be a crisis worker, showing how hard work and dedication can positively impact a client's life, knowing that there are certified specialists that have lived experience, showing that crisis workers should practice patience, have empathy, they need thick skin, they need a sense of humor, should not take things said by the clients personally, need to adapt to a fast-paced environment, and need to have dedication to their job as a crisis worker. Professional connections and insights. This research has taught us about the real-world crisis intervention work by learning and reaffirming that there are pros and cons of being a crisis worker. There will be loss of life. You will have to sheet clients that are involuntarily admitted. You will need the ability to make client-centered decisions to best help the client at their specific time of need. There are some state-funded resources which helps the clients be able to have the ability to walk into the crisis center and receive help for free. If there was a crisis center transportation available, then more clients may be able to utilize the crisis center, and the more staff there, the better care the clients may receive. The clients may be referred out to a different level of care, so you do not always see the impact and positive changes that they have made. There will be burnout at times, and you will see a lot of different cases, and not every case will have the same solution.
Yeah, so as far as like just kind of who can access it, like we've said before, it is a 24-hour facility, open 7 days a week. The best way to get the whole process started is by calling that number ending in 2500. You'll get directed to like someone who will send your call to the right places, whether that's, you know, a referral to MCOT or a referral to the crisis center. They'll help be able to navigate that for you. And then the discussion question we have for you guys is, so the Crisis Care Center takes people no matter what their financial situation is. And do you think that should be the standard for mental health care, or are there significant risks by welcoming everyone? And that's the end of our presentation. Thank you.
Thank you.
Thank you.